In 2010, roughly 3,100 California residents died prematurely due to a lack of access to healthcare in just 1 year. That works out to about 3 deaths every hour, and this number is only going up. One California farm worker, Marisol, making around $50,000 to $65,000 annually, has trouble going to medical checkups saying, "I either pay my rent or I go to the doctor." This lack of medical access proved an issue when she noticed what could be early stages of breast cancer developing. Healthcare costs in California are at an all-time high, and many Americans across California are avoiding going to checkups unless absolutely necessary. In fact, roughly 28% say that they have skipped a routine doctor's visit due to worries about costs, and nearly 22% skipped a recommended medical test or treatment due to similar reasons. Californians currently owe over $10.5 billion in medical debt. Over a third of people in California who did manage to get healthcare couldn't pay their medical bills. In addition, a shockingly 81% of respondents to a recent survey reported feeling worried or anxious about paying medical costs in the future. Billions of dollars every year spent by Californian families are wasted due to unfairly high prices caused by healthcare monopolies and unnecessary middlemen. Wages in the state, which go up by around 2% annually, are simply not growing as fast as healthcare prices, which increase about 5% every year. Here we have a testimony from a woman by the name of Cynthia, who grew up in South LA and has problems with asthma early on in her life.
My name is Cynthia. I was born in Mexico, and my family settled here in Southeast Los Angeles. And I'm now here in Southeast LA, raising a family of my own. And I love my community. I love my neighbors, but I worry about the future of my community. Growing up, I had severe asthma, and my parents had to make a tough choice when it came to healthcare access. My dad worked 7 days a week, and even then, we couldn't afford the hospital stays that I would have to do a couple times a year, ER visits at a monthly basis, unfortunately. So my parents decided to drive across the border and to see a doctor that could help me breathe. Now as a mom, I realize that those were really tough choices for my parents. I have a daughter who has asthma too, and I worry about her, and I worry about the other families that are going to have to make tough choices as well.
Cynthia's video highlights a reality that many Californians face every day of not being able to access healthcare. She was forced to travel across the border to Mexico because medical care there was significantly more affordable than what was available in California. When people must leave the country to simply receive basic medical treatment, it means that the healthcare system is failing to meet the needs of many residents. Her experience, however, is not unique. Like we said before, many Californians struggle with the high cost of healthcare, having to search elsewhere like Cynthia, or even skip medical visits entirely. Unfortunately, delaying care often allows for health problems to worsen, resulting in more serious illnesses or even higher medical expenses later down the road. We also have a video of Johanna Scott and Hannah White talking about their problems, struggles, and concerns when it comes to their healthcare costs.
I have my insurance. I'm going to die this year. That's the brass tacks, unfortunately. I won't be able to afford my medication. I won't be able to afford my treatment. Considering that the immunotherapy, I believe I would have to have it once a week for the next 2 years, I believe is what they were telling me. It's roughly anywhere between $20,000 to $45,000 per session. That's more than I make in income a year.
I had only a small subsidy, but the cost of my plan without the subsidy went up almost 50% for this year. I decided that for me personally, I needed to eat that cost and figure out how to kind of tighten my belt in other areas of my budget. But my husband made the decision to go without a marketplace plan this year.
And I know there's so many other people, and it's not like I'm this big important person, but to my family and my friends, I am important. And I would like to live for for as long as I can. And there's a lot of people that are being affected, not just adults, they're children. There are elderly people that depend on these subsidies, that depend on being able to have insurance so they can continue living their lives.
As you can see, this is a huge issue. Californians should feel like they don't need to worry about paying for health insurance, since everyone needs appropriate medical attention to live. We need a solution. We need single-payer healthcare. Single-payer healthcare is a system where all medical costs are paid for by one single payer. This means that the Californian government would pay for all healthcare in the state, as funded by taxes. Single payer would eliminate for-profit insurance companies, stopping them from overcharging for essential needs. Without this unnecessary middleman, prices would go down. One survey showed that 65% of Californian residents would support a healthcare system paid for by the government that would potentially eliminate private health insurance. With a single-payer system, the approximately 10% of Californians who are uninsured right now would have access to the same quality of healthcare that everyone else in the state has. UCSF found in 2020 that switching to a single-payer system would save money over time. This is likely because, by removing private insurance companies, we eliminate the for-profit middlemen that raise prices unfairly. This also dispels the most common worry about single-payer healthcare, that it would be expensive for states to run due to increased taxes. The biggest advantage of single-payer healthcare is that it would provide the same care for everyone. This means that no matter what someone's income is, they would be able to receive medical treatment. Another major improvement would be a decrease in administrative costs for healthcare providers, as there would be no need for employees whose jobs are to file and deny claims. Overall, single-payer healthcare in California would fix what's broken with our current system. Now, you may be asking yourself, what can I do to help? One way is by supporting Tom Steyer for governor of California. He is running on a campaign that would move California to a single-payer healthcare system that would make medical care cheaper and more accessible to this state's residents. Steyer promises to cut out insurance companies and improve costs.
If you look at single-payer systems across the world, they cost about half as much as our system, and they deliver healthcare outcomes that are at least as good as our system. When you ask me how long it's going to take, I will start on day one, and I will get going on day one. And this is why the nurses support me, is they know I'm absolutely serious about this. The idea that the system we have is sustainable is not true. If we're going to and you can see that because what we're seeing every year is the state taking away healthcare in one way or another from Californians. So first they started by saying we had said we will cover everybody regardless of immigration status. They changed that. But do we have to do this? We actually have to do this. And I'm the person in this race who said I'm absolutely committed to this because I'm committed to healthcare as a right for Californians.
Now, if you are unable to vote or simply disagree with Steyer's other views, you can also donate to nonprofit free care clinics around the Bay Area that provide healthcare to those in need, such as Clinic by the Bay and Rhoda Care Bay Area. The links are on screen. They support low-income and uninsured individuals who simply cannot afford the high costs of healthcare and rely on donations and volunteer work to operate. Thank you for watching. We hope this inspires changes in California's healthcare system.